Kia ora koutou katoa. Good afternoon, everyone. As you'll be aware, 2 cases of COVID-19 have been identified today beyond the Auckland boundary. One is in Raglan, the other is in Hamilton. The 2 cases are connected to one another, but at this stage we have not connected them to our Auckland outbreak. I'll hand now over to Dr. Bloomfield to provide an update on these and other cases identified over the past 24 hours before setting out what actions ministers have agreed to today. Dr. Bloomfield.
Thank you, Prime Minister. Tēnā koutou katoa. So today there are a total of 33 new community cases to report. 32 of these are Auckland-based and 1 case is in the Waikato. Now you will have seen, and the Prime Minister's just mentioned it, that actually we are reporting a second case in Waikato, but it's not included in today's figures because of the time it was reported. It will be in tomorrow's numbers. Now of today's cases in total, 15 are yet to be linked. 2 of those have a possible link, and 3 of those 15 are all actually one whānau that live in a single household. Interviews are underway, and we would fully expect that those will identify links and connections to the existing outbreak. And of yesterday's cases reported, just 4 remain unlinked at this point, with investigations ongoing. In the Auckland region, there are now 5 active subclusters. That is where there are new cases that are emerging over recent days, and our public health efforts are significantly focused on those. On to those 2 cases in the Waikato. One of these cases lives in Raglan, the other in Hamilton East, and they are known associates or contacts. However, at this stage, there's no obvious link between these 2 cases and the Auckland outbreak, and we would expect that both the interviews of the cases and the whole genome sequencing, which has been done with urgency, will help us elaborate what that link might be. The case in Raglan and their family has been moved to a quarantine facility in Auckland. That case, the Raglan-based one, was tested on the 1st of October, having become unwell, and their infectious period is deemed to be from the 27th of September. So a pop-up testing centre has been set up at Raglan in the Raglan Rugby Grounds car park on Cross Street, and anyone in Raglan with symptoms is urged to get a test today. And in Raglan, if you haven't yet been vaccinated, now is the right time to do so. There's been quite a big increase in vaccination in Raglan over the last week or 2, which is great to see. Vaccination is available today at the Raglan Area School from 2:30 p.m. Just turn up. The second Waikato case is, as I say, a known contact of the Raglan case and was tested yesterday evening after becoming unwell. This person was transferred safely overnight to Waikato Hospital when the symptoms worsened, and they are being treated for COVID-19 related symptoms. And there are no exposure events at the hospital because they were prepared and ready to receive this person. That second case's household contacts are currently self-isolating, and we are getting rapid testing done on them. So today in Hamilton, the testing centres at the Founders Theatres car park in Hamilton CBD will have additional capacity added, and there will be a pop-up centre at the Claudelands Event Centre that's being set up at the moment. Again, anyone in Hamilton with any symptoms whatsoever of COVID-19 are asked to please get tested and isolate till you receive your result. There are also walk-in vaccinations available in Hamilton today at Te Awa, the base, and the Prime Minister will have further information about vaccination opportunities. There may be public exposure events which will be listed as locations of interest on the Ministry of Health website through the afternoon, so please do watch out for those. A quick update on the Auckland-based truck driver that is also being reported in today's number, and we made a media release about that last evening. So this person was picked up through routine surveillance, showing the value of this testing. They had previously returned a negative test on September the 24th, and then tested positive 2 days ago. Their infectious period is deemed to be from the 28th of September. Now that driver, when the positive result came through, was in Palmerston North and is isolating at a bespoke facility on the hospital grounds in Palmerston North. Their two household contacts in Auckland are also self-isolating. Both of them have returned initial negative test results, as have 3 other close contacts. Locations of interest between Auckland and Palmerston North over a number of days while this driver has been driving through, mostly petrol stations. They have been put on the Ministry's website, so please do look at those. Again, there is whole genome sequencing underway to determine the link with the current outbreak in Auckland. Just briefly then on hospitalisations, 26 people in hospital today, the majority in Auckland, and as I mentioned earlier, the one person in hospital in Hamilton at Waikato Base Hospital, and 3 of the total number of people in hospital are in ICU, all at Middlemore. Testing continues to go well, and it's hard for me to emphasise enough how important it is for our testing to continue, and in particular anyone with any symptoms at all, wherever you are in New Zealand. Last Friday was the highest testing day for Metro Auckland in over a month, with nearly 16,000 tests completed, a huge effort. Thank you to all involved. And from this Monday, the 4th of October, that's tomorrow, the Otara Community Testing Centre in the town centre there at Otara will be open from 6:30 a.m. to help provide access for essential workers to surveillance testing. A reminder that there is also testing ongoing at a number of accommodation places across Auckland, residential facilities, boarding houses, community housing providers. It is voluntary for those residents, and around 50 of those facilities are being moved through over the last few days and in the coming day or two. And finally, all of the facilities there are within all of the testing has been set up as within a 30-minute walk of other testing facilities where we have seen positive cases or close contacts. So it's a very mobile population, and we are going out with specific teams to find those people. Back to you, Prime Minister.
Thank you, Dr. Bloomfield. In light of the positive case detected in both Raglan and Hamilton, ministers have agreed today to move these areas into level 3 restrictions alongside Auckland from 11:59 p.m. this evening. I'll now share a bit more specificity around the areas that will be covered by level 3 restrictions. It will include Raglan, then coming from north down south to Kowhata, Huntly, Ngarawahia and Hamilton City, based on the Hamilton City boundary. These boundaries will be published online. Just a word about the surrounding boundary areas. In terms of management of the boundary, in this case, Auckland's boundary will remain in place as it stands. For these new Hamilton areas, there will be spot checks around these boundary areas, but it will not be the same as the hard boundary we've been operating for the Auckland outbreak. The reason for that is simply a practical one. The Hamilton area simply has too many feeder roads for us to successfully operate a hard boundary around the outskirts of the area. So we ask people please to maintain compliance, and there will be spot checks in place. For those who live and work across these areas, we ask that those who can work from home do work from home. We intend at this stage for these level 3 restrictions to apply for the next 5 days. This is the same approach we took when cases emerged in the Upper Hauraki area. It gives us the opportunity to contact trace and widely test in the coming days to assess if the virus has spread widely. If you live in these areas or have visited these areas and are experiencing even mild symptoms, please do get a test. After 5 days of wide testing, contact tracing and wastewater testing, we will assess whether the restrictions need to remain in place. It is noteworthy, however, we have had wastewater testing in the Hamilton area on the 29th and 30th of September. Those have been negative tests. Of course, further testing will assist us as we seek to ascertain how widespread these cases may be. But testing is not my only request of those who live in this area, or indeed those who live anywhere in Auckland. It is not a coincidence that those in our current outbreak have not been vaccinated. Those who have not had a vaccine in New Zealand are currently in the minority, but they are the vast majority of our cases. That is because the vaccine works, but it's also because the virus is literally finding unvaccinated people. Vaccination makes a difference. It keeps people safe, but it also gives us choices. And this is how stark those choices are. If we had a vaccination rate at 90% or above in either Hamilton or Raglan, it is highly unlikely that we would be here today announcing level 3 restrictions. Instead, we would be able to rely on other tools like contact tracing and much lower level public health measures. But while we are still vaccinating, we have fewer choices in how we react to cases. And so this is a message for the rest of New Zealand. We are doing everything that we can to keep cases confined to Auckland and managing them there. The people of Auckland are sacrificing a lot to do that too. But they are doing that to give everyone else time to be vaccinated. If, in the meantime, the virus moves beyond the Auckland boundary and the places it moves to have low vaccination rates, then today is an example of how we will need to respond. So please, get vaccinated today if you want to avoid level 3 in your community, and we can avoid it in the future. Now, I know some people are nervous about the vaccine and wanting to wait a bit longer to see what happens. I understand. It's natural to have questions, but I can assure you the vaccine is safe and the experience is friendly and supportive. There are nurses and healthcare professionals on site. You get looked after, and if you have questions, you can ask them while you're there with people who are knowledgeable and supportive. There are still 887,000 eligible New Zealanders who haven't been vaccinated. But on the flip side, 79% have had their first dose. We have a different approach to COVID within our sights and in our hands. So as we all look ahead and we think about summer and the plans that we are making, make the first step a vaccine. It is the thing that will make those summer plans possible. So on that note, in the Waikato, there are 1,500 bookings available today and 2,800 available tomorrow. In terms of walk-in vaccinations that are available right now, you can find those at Te Awa, the base. Rokua, Haora or Tainui is open until 3:15 today. Rahui, Pokeka and Huntly, the Community Vaccination Centre, is open for walk-ins until 3:30. Anglesea Pharmacy is open until 11 p.m. Sanders Pharmacy until 3 p.m. And there are approximately 80 pharmacies, GPs and vaccination centres, including mobile services across the Waikato. Also today, there will be a pop-up vaccination centre in Raglan at 2:30 p.m. today, and we'll make sure that we put details of that out for anyone locally. Before I finish today, a quick reminder that tomorrow we'll be talking more about our roadmap forward, in particular for Auckland. On Tuesday, we have another step up in our vaccine campaign, and you can expect that alongside each day our reporting on developments in Hamilton. Till then, though, we are now happy to take questions.
Is there anything that you can tell us from the preliminary contact tracing interviews about these two Waikato cases, whether they went to any potential super spreader events, whether they were in front-facing employment?
So we do know that we will have a number of locations of interest around, in particular, our Hamilton case, and we'll continue to publish those. We've had it described to us that they've moved locally over a period of time. We can make an assumption around infectiousness given that they infected the person in Raglan on or around the 26th of September, so that gives you an idea of the window timeframes that we're looking at. I haven't been advised that there's been any movement outside of the region as yet, and at this stage we have not identified any movement from anyone from Auckland in contact with this family, but that's a key part of our source investigation.
days for the Waikato in level 3. Is that going to extend to Auckland as well? Will it remain in level 3 for longer?
No, so what is happening here in the Hamilton area and surrounding area, think of as discrete measures for that area. Because obviously what's happened here is we've got a new outbreak in the Hamilton area, so we'll be treating that distinct from what we're dealing with in Auckland. So we'll still be making announcements on what we intend to happen in Auckland tomorrow. I'll let you finish, Trevor, and then I'll come to Jane and then Derek.
Why not do the same thing for Palmerston North? Why not?
Yeah, a bit of a different set of circumstances for that individual. I'll let Dr. Bloomfield talk a little bit about what we've managed. Yeah. One thing we know is, obviously, having come from Auckland, we know the source. So that's really key. We know that someone, this is a person in Auckland, so it's easier to connect it to our Auckland outbreak. We also know all of their movements. Here, we've got 2 cases. We don't know where those individuals got it from, so therefore it's harder for us to define the edges of that outbreak, so that makes it very different.
Yes, so the person in Palmerston North just happened to be in Palmerston North when the positive test came through and is therefore being isolated and managed there. The exposure events, including locations of interest, are all identifiable, and this person is Auckland-based and obviously as it works as a driver going down. So we're not worried about there being undetected community spread in Palmerston North. So saying, of course, we're wanting testing there of anyone who's symptomatic, and we are increasing wastewater testing in Palmerston North and some of those surrounding towns. Sorry?
No. No, in the Palmerston North case was not vaccinated. None of the individuals from Raglan or Hamilton were vaccinated, and this is, I think, the one of the points I wanted to make. Here we have a situation where actually the vast majority of New Zealanders eligible now are being vaccinated, but the virus is finding our unvaccinated individuals. Interesting and of note, we've been advised that the household members of the Palmerston North, the truck driver, are vaccinated and have not yet tested positive. Jane, I'll come to you.
What can you tell us about those subclusters in Auckland, for example? Are they connected to the emergency transitional housing population, and are any of those results, those positive results, from the testing within those facilities?
So the subclusters that are connected to transitional and emergency housing are ones we've already talked about during last week. There are 2 more new emergent ones, but they're not related to the housing sort of situations. Yes, and some of those positive cases, a number of those positive cases coming through today and yesterday are from those subclusters that do involve transitional housing. But as far as I'm aware, none have been discovered through the surveillance testing we're doing of the other locations. They have all come out of the places we knew there were already active cases and within the family and contacts there.
Also, Prime Minister, can you just talk a bit about the vaccination requirements at the border for non-citizens?
Yes. So you will have seen today 2 significant announcements. One from the side of the government, where we've now announced that it's our intention in the future to require vaccines for non-citizens entering into New Zealand. At the same time, you will have seen that Air New Zealand has announced a requirement for individuals using their international services to be vaccinated. I don't think either of these requirements will come as a surprise to New Zealanders. Of course, we are pushing very hard to have as many people vaccinated in New Zealand to keep them safe. It makes sense that we ask that at our border for those who are non-citizens.
Will this bring us into line, I suppose, with other countries and potentially, will it relieve pressure on MIQ? But does that take out a certain cohort that would otherwise be
certainly it helps prepare us for the future. You will have seen that part of the Reconnecting New Zealand work talks about greater flexibility for fully vaccinated individuals, shortened periods of isolation, the possibility of self-isolation at home. All of that is predicated on people being vaccinated. So it is if you like, a precursor to greater flexibility at our border. Also, for me, this is, why should New Zealand carry the cost of individuals who are visiting New Zealand who choose not to be vaccinated? And it is a cost in many, many ways. It does not extend to citizens because, of course, we cannot preclude New Zealanders from being able to return to their home and put a condition on that includes vaccine.
Last week we reported that there are actual real problems with the security of the vaccine confirmation because of the way that it is at the moment. You don't have to present ID. You could, it's basically a written letter. Given this is becoming so important and will be, what's being done to make sure that it's proved that people who say they're vaccinated are, and actually that they have the document that can prove it properly? Yeah,
and this is one of the issues, in part that has meant that we've taken this approach at this point has been actually we do not have internationally a system of documentation that can be universally recognised. We have the backup measure at the moment, though, that we are still using measures like our quarantine facilities that add that extra layer of safety. So we've got that as a backup. But in the future, you will certainly want to be able to rely much more meaningfully on documentation. New Zealand is working up a system that essentially aligns us with internationally recognised systems like those being used by the EU.
Aren't the big holes at the moment, though, in the actual documents that people are getting, like the vaccinations now? Realistically, if you said prove...
Are you, just to narrow down, and I'll have Dr. Do you mean internationally or for us?
Just at the moment, with the system that you can log on, you don't have to prove ID. So, I mean, someone else could go and get vaccinated in my name, for example, and I could get the certificate and then I'm vaccinated.
And that individual would never then be able to carry their own documentation. It is quite an effort for someone to go to have someone else to be vaccinated on their behalf in order to then acquire their documentation in an environment where in the future every New Zealander is likely to need their own individual documentation. The issue actually for us at the border is the international documentation, because there isn't a consistent approach. And that is one of the things that, yes, we've got our own systems for checking, but in the future I hope we will have a system that works a little more robustly. But Dr. Bloomfield.
So 3 things here. First of all, we made a deliberate decision, and I think it was the right one, that people didn't need to show ID when they went and got vaccinated. But that doesn't mean they don't have to identify who they are so that we can link them into the system. So as having my experience this morning, I was asked 3 times my date of birth. And so people have to be able to be identified and linked to an NHI number, and through that NHI number we can then record the vaccination in the COVID immunisation register.
Yeah.
The second thing is, at the moment, yes, people can make a request to be sent a letter to say they have been vaccinated, and people will realise that early on in the program, and still in many places, people would get a card manually recording their vaccination. However, as we move into this next phase, this is becoming an electronic process that will require people to identify themselves and provide a form of identification when they register, to then be able to provide proof of their vaccination status. And so that part of the process, when we move into the next phase, will link identification of an individual with their vaccination status.
We come to Mikey and then Derek.
Dr. Bloomfield, did you get your second jab today?
I did.
How was it?
Well, it's a nice feeling to be fully vaccinated, and in another couple of weeks I'll be fully immunised, and I'm hopeful that the next day or two I feel fine.
Just in terms of the truck driver, you say that both household contacts were vaccinated. Does this show that the truck driver may be vaccine hesitant, and does it also show that those who are essential workers moving out of Auckland should only be able to do so if they are vaccinated?
Yeah, so look, one of the things that we are considering is whether or not, in addition to the testing requirements, and the testing requirement at our boundary in Auckland is what has enabled us to pick up this case, whether in addition it is therefore a reasonable expectation to have a vaccine requirement alongside it. But I think what we need to remember is that, as unfortunately is the case today, it's not necessarily the fact that we will have a border forever between Auckland and the rest of the country. We need all of New Zealand to be vaccinated. Auckland at the moment is in level 3 restrictions and containing this outbreak to give all of us time to be vaccinated, time to keep ourselves safe, and the opportunity to ensure that in the future we aren't in the position where we have to contain this virus by using level 3 restrictions.
Because in terms of international travellers coming here and the requirements, the new requirements
Yeah.
for them, you said, New Zealand shouldn't have to carry the cost of non-vaccinated people coming here.
Yep.
And I guess the rest of New Zealand would probably say the same.
in terms of Aucklanders moving in and out of Auckland, that we shouldn't have to carry the cost of non-vaccinated people moving out.
It would be wrong to paint Aucklanders as somehow the issue here. They are not. They are carrying a huge burden and a weight by being in the restrictions that they are for the time that they have in order to try and keep this outbreak away from the rest of New Zealand. The point is that we, as a nation, the way that we can thank them for what they're doing is making sure that we all get vaccinated. That's the way we can protect ourselves. A boundary is not an ironclad way of protecting ourselves against COVID. A vaccine is.
So can I just clarify that? So
Yeah.
you are considering
We
whether
are,
essential workers need to be
whilst I still hold that view, we have asked that question. We are looking at that issue. But again, it is none of those elements are necessarily ironclad. We have individuals who move for single movements, for instance. We have others who move more frequently. This is an individual who is being tested regularly, and we still have this case.
Can you give us an idea of what the traffic is over the Auckland boundary at the moment at level 3?
I can't give you the specific number. We haven't seen a large change over time because of the way I can give you I'm told that we think that in the last few days we've had 5,000 to 7,000 people moving in and around of the Hamilton region. That's some data that I have, but I don't have the latest on Auckland.
Do you have
Oh, sorry, Dr.
Maybe
Bill.
just to comment on the testing, and again, just to reiterate, this person was being tested regularly, and that's how the infection was found. And the last data I saw is that the compliance with the testing requirement has been around 95, 96% at the boundary.
practical at all to increase that frequency? And did ministers consider
Increase the frequency of testing.
Yes. Did ministers consider other ways to strengthen that boundary, even moving Auckland to level 4, which would lessen that traffic over the boundary?
Well, keeping in mind that, of course, even in level 4, we still had freight movements. I mean, it's essentially impossible to create a situation where New Zealand can continue to operate with zero movement from Auckland. Yes, indeed. But whilst I don't have the detail of this particular individual, keep in mind that the 2 cases we've had that have come out in the past, that we had the Tauranga situation, that was food. And so it is very, very difficult to have a situation where you don't have those movements and therefore zero risk. And that is why we've always said, yes, we've got the boundary, we've got a testing requirement, we use PCR weekly because that's more likely to pick up that wider infectivity window, but nothing is ironclad. So that's why we all need to make sure we get vaccinated.
Have you considered more frequent than weekly testing? Is that practical at all?
We haven't considered more frequent testing. Keep in mind, literally thousands of individuals for very legitimate reason, the vast bulk of which is freight, move across that boundary. So it probably, I think, would pose some practical issues.
How many people have been granted those border exemptions and what percentage of them haven't been vaccinated? How many potential risk vectors are crossing the border?
No, we don't, because in those individual, we would have to be able to categorise someone's individual occupation, and employers would have to have the ability to request that medical information from their individuals. So no, we don't. We have, however, worked with freight companies to set up workplace vaccinations, so that has been one of our target areas.
No idea how many unvaccinated people are crossing the border every day?
I can tell you that across New Zealand, 79% of eligible New Zealanders have had their first dose. In Auckland, roughly 83.5% have had their first dose. It is the minority. We need, though, all New Zealanders, not just those dealing in freight, to be vaccinated.
Prime Minister, are you happy with the police response to the protests in Auckland yesterday?
I'm sorry, I realise that I haven't panned across to some who have had no question. I'm happy to answer that, though. Look, ultimately, the police response to the protest activity in Auckland on Saturday is a matter for them. It's operational. Very important that I don't step into their decision making on the ground. But I have faith in the judgment of the police to manage all sorts of situations within COVID when it comes to compliance. I do, however, have a personal view on the protest itself. It was wrong. Obviously, it was illegal, but also it was morally wrong. What does it say to every Aucklander who has given up a huge amount over the past few weeks to do the right thing and keep other Aucklanders safe? It was a slap in the face to them.
So what
The
would you,
police
so
are
what
slapping
would
those people in
you,
the face,
so
though,
what
by-
would
I'll just let Jane finish.
So what would Aucklanders then think? That they didn't face any further consequences for exactly those reasons?
Well, ultimately, that is for the police to consider, and I understand they're still considering it. So let's let them do their job when it comes to possible prosecutions. My personal view, though, continues to be that this was a complete slap in the face to every Aucklander, and to every Aucklander who has followed the rules to keep their friends and family safe.
Haven't
So
police
has
sent a message
also
saying that
with-
there's one rule for everyone in Auckland and another rule for Brian Tamaki
No.
and his... And
No,
his
I don't agree with
acolytes?
that. No.
And also, were the Waikato cases at all connected to gangs? Are there any gang connections?
We're still very early on in case investigations and identifying any potential sources for these families. So I wouldn't speculate on any of that at this point.
Social movements are very limited at this stage.
We've been told that there are extensive movements around the region, but there is no travel in or out of Auckland, and no one that they've had contact with who they believe has been from Auckland.
The nature of those movements, were they big social events at all? And like
Not that I haven't been advised of the detail.
No, we don't have that information as yet, but what I will say is we're getting great cooperation and engagement.
Lots of
so
help.
we should be able to identify any quite quickly.
Like that sort of young adult cohort who are quite social?
No.
No. This is
The person in Hamilton was in their 40s, and the person in Raglan in their 50s.
Yeah. And really important, as Dr. Bloomfield has said, the family have been really helpful, providing all the information they can, despite having a really unwell family member. So,
Given this spread and the way that things are tracking, do you now regret moving Auckland to alert level 3 almost 2 weeks ago?
No.
Certainly not.
No, and at this stage, there's nothing here to suggest that shift necessarily has led to any change in what we are seeing currently. So no, not at all. And one of the key things for us to continue to keep in mind is that multiple drivers here. Yes, we want to continue to stamp out this outbreak that we have in Auckland. But at the same time, it does require us to keep everyone moving as a team as well. And it's a very hard ask to keep everyone in level 4 restrictions for very prolonged periods of time. The advice we had from public health was that we should move. That was the advice on the ground in Auckland, as well as from the team at the ministry.
And on the vaccination campaign, I mean, given that first doses have slowed in recent days or weeks, and there's increasing concern about Māori and Pacifica not getting vaccinated. I mean, do you feel like you're reaching the limit of what you can do?
No, not at all. No one is ready to say that, and not, in fact, when actually some of our first dose numbers are still holding up. I'll correct myself. In Auckland, we're now at 83.9%. 4,625 first doses were administered in Auckland yesterday. And yes, we've had very high numbers, but when I was growing up, that is almost my entire town's worth of people being vaccinated with a first dose in Auckland alone at this point in the program. The key will be to continue to maintain that first dose momentum, because that'll be an indication of how many we can fully vaccinate. The rest of the country, now it's 79%. We just need to keep going.
What about the Māori and Pacifica question? What about reaching those communities? Because there seems to be some difficulty there. Your own Minister, Penny Henare, is expressing concern about the ability to achieve that.
I would describe it as slower, but not that it's impossible. It has been slower, but you can see it in our 65 plus rates really high for our Māori population. So that to me demonstrates what's possible. Did you have anything further there, Dr.
Just endorse that, and I think what you got a sense of from Minister Henare's comments was he's not going to be happy until those rates go up, and that's why he's getting out and about. And the Prime Minister and I were on discussions with DHBs in the last 2 weeks so that we could be absolutely sure the right effort was going in to get the vaccine to these populations.
Not any one thing for any particular community, but what is it? What do you put those slower Māori vaccination rates down to, and what are you going to do specifically to get those numbers up?
So, look, I am not the person to stand on this podium and give you a view on exactly what might be happening across our Māori and Pacific populations when it comes to vaccines. But those who are the ones that we have a duty to make sure that we're supporting them. And a week ago now, Dr. Bloomfield and I virtually sat down with some of our providers across the country where we have the highest population of Māori and Pacific. And there, now, the switch in strategy is not to just have static mobile sites, but to take vaccination into communities, onto people's doorsteps and into their homes. And that's the switch you'll see in our vaccination program from here. Mark.
Dr. Bloomfield, what is the public health risk of a gathering of some 2,000 people outdoors, like we saw yesterday?
Well, it's an unnecessary risk and an illegal risk, as the Prime Minister said. And I just, it's frustrating and disappointing.
We have 15 new unlinked cases today, which brings the total number of unlinked cases over the past 14 days to 23.
Yeah, correct.
Why is that number seems to be rising? Are you confident that you do have the outbreak more or less ring-fenced? Can you talk about that a little bit?
We were just discussing that a little bit before we came down.
Yeah, well, a couple of things there is, again, even within those unlinked cases, there are some groups in there, so we count all the cases, 3 are in one household. But what we do find is in the subsequent 24, 48 hours that we get through most of those, and then as the whole genome sequencing comes through, we're able to link them. Our priority is always finding out the contacts and testing and isolating those people, but also just trying to work back and find out, are there any other chains of transmission? And that's why these active subclusters are the ones that are being focused on every day, and where the testing is being focused on making sure we're going widely around those new subclusters.
I'm going to come here, and then I am going to try and, if I may, just keep this one a little tighter today. So I'll come in the front, and then I'm going to finish with you. You haven't had a question.
Just on those 23 unlinked cases, 19 of those have come over this weekend. How concerning is that? And can you rule out that Auckland could move back to level 4 this week?
That is not part of our consideration. So that should rule that out for you. I think one of the things, and we'll probably spend a bit more time on this tomorrow, but one of the things that has become quite clear is that the original outbreak that we dealt with in Auckland through the efforts of Aucklanders has essentially ended. And what we've now seen is a subsequent outbreak that has emerged. And as with any outbreak, when you're at the beginning of it, putting a ring around it and determining its scale does take a bit of time. And that appears to be what we're at the beginning of with this subsequent outbreak that we're dealing with at the moment. But if you don't mind, I do want to spend a bit more time talking about that tomorrow. It is specific to Auckland, and you'll see reflected in some of our decision-making, our thinking around what we're learning about the specifics of what's happening there as a pattern.
Just on the Waikato border, can you just explain the rationale of why not move the whole of Waikato to level 3?
Yeah. So obviously what we've done is taken into account those areas where there is a very close relationship between workforce and accessing essential services, and of course the fact that they sit between the Auckland and Hamilton border. So that's the rationale for Te Kauwhata, Huntly and Ngātaohia, because you've got that transit path between Auckland and Hamilton. Otherwise you'd have a situation where you'd have one in 3, another in 3, and this piece in the middle, which in our mind didn't make sense. And also, I actually expect that the local community probably would have virtually moved themselves into a level 3 environment regardless. Raglan on the west, and then for essentially we've then used the Hamilton City boundary. So that's the basis of that decision.
Can I just clarify that?
I'll let you clarify. I'm then going to come back to everyone, and just because Derek is demonstrating such desperation, I'll finish there.
Can I just clarify that this is the approach going forward, unless you have regional vaccine coverage of 90%, this is how you're going to...
What I'm indicating today is that we would have had the possibility of a very different decision today if we had higher level of vaccination, and we've been saying this all the way through. Very, very simple equation. High vaccination rates means lower restrictions, so please get vaccinated.
We're aware of a large number of cars being allowed to cross the border from Northland into Auckland yesterday to pick up a body, and that was permitted?
I couldn't speak to that. It is a permitted activity for people to accompany a deceased person. I can't speak to a specific case.
We also understand that the Hamilton case expressed anti-vax views at the hospital. Can you shed any light on that?
I can't speak to that. All I can say is that we have very high levels of cooperation with the family who are helping us a lot as we work to contact trace.
When did the government find out about the Raglan case being tested positive?
That result came in over the evening. We were informed in the morning. So, yeah. And Derek.
Do you think that, did you consider at all moving, because you said there were 5,000 to 7,000 people who were moving in and out of the Hamilton region?
Yeah, there was a call between leaders in the community, and that was an indicative number. I actually can't give you more specificity than that, so that hasn't come from me, but from local leaders.
You didn't consider moving all of the North Island to level 3 on that basis?
No, it wasn't. In fact, what I would say is that this decision I would put on the cautious side. And that's because simply not knowing at this stage the level of circulation in the community and the source. So, no, there wasn't a view that the rest of the North Island needed to move, and in fact this was considered the most cautious approach.
Expecting the genome sequencing back tomorrow.
Most likely.
No wastewater results in the Hamilton region. Do you think it's likely that it did come from Auckland?
Well, 29th and 30th we had negative wastewater testing in Hamilton. More wastewater testing we'll be collecting and reporting on over the coming days.
Yeah, I think they're two separate things, but what the wastewater testing suggests is there's not a lot of infections in Hamilton, but almost certainly this case will be linked to the Auckland outbreak, and it's just the whole genome sequencing, and the interview will, I'm sure, elaborate this.
It needs to show that there are little cases in Auckland that are still under the radar. Can you give us a view of how much of the surveillance testing that's been happening, including in the transitional emergency housing and across those suburbs of interest, how much, because that's trying to find cases beyond the contact tracing, etc. So how useful has that been in finding cases?
Well, it's been very useful, and it has found some cases. But what it also is helpful is giving us an extent of the control around those subclusters, and so that's the real value. It helps us identify what the margins are, and therefore where we need to focus the contact tracing efforts.
So Hamilton, if you want to help us with our decisions over the coming days, please get tested. Because that will give us that extra information we need to just see whether or not we have anything more widespread while we undertake that source investigation to determine exactly what has happened here. So please get tested, get vaccinated. We'll be back on the podium 4 o'clock tomorrow with decisions and further roadmap for Auckland. So please feel free to tune in then. Thank you.